You're muted, Heatherlyn.
Dang it. We've been doing this for so long, I forgot to even check. All right, well, what I said was welcome to the Flint Community Webinar on Coronavirus. This is week 129. You'd think we'd have it down by now, but sorry about that. It is Friday, September 2nd. We are so glad that you are here with us, that you've joined us. The webinar is sponsored by the Healthy Flint Research Coordinating Center and the Flint Center for Health Equity Solutions. I'm your moderator this week, Heatherlyn Uphold. I'm an assistant professor with Michigan State University, as well as a co-director for the Healthy Flint Research Coordinating Center. And I'm so excited to be here with you, as well as along with all of our wonderful partners that join us every single week. I got to tell you, we could not do this webinar without them. And we are so glad that they continue to join us, support us, and help us provide this important community resource. This week, we're going to be sharing some past highlights that are still so very relevant to what we're seeing in our community this week and now, beginning with Dr. Shanina Knighton. So she's going to remind us about infection prevention strategies. We couldn't miss the chance to bring in one of Dr. Susan Woolford's wonderful medical moments. She's going to be talking about COVID testing. And then finally, Dr. Jeff Ram from Wayne State University will be talking about wastewater testing. So we're going to start this hour out with a clip from Dr. Knighton.
I'm here today to share information in regards to COVID-19 prevention, vaccines, as well as, information about the disparities within our communities. Next slide, please. So today we'll just cover what it is that we know so far. We'll talk briefly about the vaccine, and we'll also talk about some practical prevention tips. Next slide. But first and foremost, I do want to discuss and just tell people about an infection preventionist. And so we might see, let's say, terms, infectious disease specialist, which would, let's say, be an MD or a physician. We may see, let's say, an epidemiologist, which may study, let's say, the statistics around diseases just in itself, as well as be able to quantify spread. But an infection preventionist differs in that we actually go through practical methods of preventing and controlling infections, which means that we must know the type of bugs that exist, how they thrive, test to identify them, and more so importantly, how to eliminate them from people and surfaces. And so a lot of bugs that you may have not heard about before the pandemic, because you may have not just been interested, is because we typically work to make sure that those outbreaks, or let's say an epidemic, does not become a pandemic. And of course, every once in a while, we have those that slip through, such as H1N1. So that would be it. And so in hospitals, we establish protocols and procedures that focus on prevention. I've been doing so in the community, helping people to think about infection prevention from the practical standpoint, and just also reminding people that everyone was given a crash course in infection prevention overnight, because we haven't had to think about how to incorporate it into our daily practices. And so today we'll go over some of those topics. Next slide, please. And so just some information. We know that there, of course, are the myths. There's the information that exists in regards to COVID just showing up. However, coronaviruses are not anything new. They've been around since the 1970s. However, this particular strain, which we know strains exist now, is because there is a different form of coronaviruses, which is COVID-19. We know that it is primarily infectious respiratory disease, even though we know that it has long-term effects on others. And we also know that it primarily enters the eyes, mouth, and the nose. And I'll talk more about, our hands being a common factor of, or contributor of how that happens. And we know that COVID-19 alone is responsible for 5% of deaths, which means that individuals that have had COVID-19 and have passed away, 95% of them also had other conditions, on average 4 other conditions, according to the Centers for Disease Control. Next slide, please. So currently we know that there are 3 vaccine candidates, 2 which are mRNA vaccines, and we have the J&J, which is a vaccine that contains the adenovirus. Next slide, please. The goals of the vaccination, and this was known like even before, and I know that the messaging may have got mixed up because there was this perception that the vaccine would eradicate COVID. But I remind people that we have to think about our blood pressure medicines, our diabetes medications, that these mechanisms are put there for us to reduce effects. They are put there for us to treat things. They are not put there to cure. So it is not a cure. And so the goal was to reduce the burden on our healthcare system. It was also to reduce the burden of symptoms, which could then cause other issues and complications for people that had other conditions. Okay, next slide. And so we know that individuals with certain conditions, whether let's say that they were an at-risk pregnancy, being an older adult, having obesity issues or severe obesity issues, heart conditions, smoking, because again, we're talking about respiratory. So it's an infectious respiratory disease. So impacting your lungs. So individuals that already had compromised symptoms were likely to have bad outcomes when it was co-associated with COVID-19. Next slide, please. So then now this is an infographic that was developed, and you'll learn more about my work in infographics as we continue to move forward. But this just is information that shows people, you know, that getting vaccinated can protect yourself and protect others around you, but it also sends the message that you can still become infected with the virus. But being vaccinated may limit the severity of symptoms that you may have. This information is very important because now that we are having individuals that are vaccinated, there's this notion of being asymptomatic. And so people have to understand that hand hygiene is important because while you may not have any negative effects from COVID, you can still pick up COVID and still spread it to others. And so we'll talk a little bit more in detail about these individual preventative practices. And so things to consider, and I bring this up if you are someone that is encouraging people to get vaccinated, if you are someone that is considering getting vaccinated, I do suggest that you go and get tested before being vaccinated. A lot of individuals may not talk about this, but it's just like the flu. We've all heard that myth or that rumor of, oh, I got the flu vaccine and it gave me the flu, which is a story. A lot of times people may not realize that their immune system may have been compromised or they may have been on the verge of already getting sick. And then, yes, the flu vaccine, while it was trying to build up antibodies, may have already pushed you over the top. So it's very important to understand like what your status is, what your health status is before getting vaccinated. There are some individuals that may go out to an exposed party and they'll say, oh, well, I'm getting ready to go out and get vaccinated because they think that they may have had COVID. But it's a suggestion that you actually wait, you know, about 3 to 5 days before going to get vaccinated because you don't want to already be at a compromised state when getting vaccinated. And so I know that this isn't something that is quite discussed often, but timing is still very important. Next slide, please. So, as we talk about vaccines and people are thinking about shifting the conversation, I always show this slide, which is from the National Notifiable Disease Surveillance System. And the reason why I share it is because we don't think about smallpox. So, smallpox is the picture that's right there on the left hand side. And you can see in the 20th century, like how many cases was held. And then, you know, you look at now, like where we are. So, it does show that vaccines do help. Okay. The other piece is that I always remind people is when my grandparents and parents were coming up, they took oatmeal baths when it came down to chicken pox. Okay. And then for us, it was the calamine lotion and it was the chicken pox party. So because it was so contagious, everyone pretty much just kind of threw their kids out in the street and said, hey, let's get them all, you know, sick and then let them all get better. But now for kids that are younger than us, or I would say even our children, they have chickenpox vaccines, so they don't have to undergo the itchy bumps. And so this is just a notion that when people do, you know, definitely talk about, well, vaccines don't work, we have to think about where we've come from and where we are right now. And sometimes we tend to not look back at some of the diseases or some of the infectious diseases that our parents may have had to deal with or grandparents. Next slide, please. So this is a video, and so if As you can see, this is someone washing their hands. I just have to bring up that only 3 to 6% of people clean their hands correctly. So they always wash the front and the back, which we know. They tend to not think about the webbing of the fingers. They tend to not think about the fingertips. They didn't tend to also not think about, where the thumb meets the hand. And so there's germs that can actually get in that web. And then even afterwards, they don't think about the fingertips. And so scrubbing your fingertips actually helps to get some of the germs from under your nails. And then also thinking about cleaning your wrists, because germs, as you're moving from your hands up to your arms, and it goes from a notion of being clean to dirty. And so even during some of the best practices, some individuals may say, well, I don't know how I got COVID. But if you're not a part of that 3%, 3 to 6% that are cleaning your hands correctly, you could wear a mask and you can do some of these other preventative measures. But if you're not cleaning your hands, then that can be a big problem. Next slide, please. It's also the same thing with mask wearing. And so, as you can see in this visual here with this individual, I describe this as being chin girdling. So, a lot of individuals will wear their mask up under their chin just for the sake of saying that they have on a mask and think that they're protecting someone, but it's really essentially just holding their chins. And so what happens is, imagine you going inside of a building, you have your mask on correctly, but then after you come out of that building and you've been exposed to everybody, the droplets, let's say, was in the elevator, and you're thinking like, oh, I'm relieved. I can't wait to let down this mask. So you then pull the mask down beneath your chin, which was your exposed area. By the way, droplets can survive on the skin for up to 9 hours. So you've now moved it down to your chin, down to your neck area, and it's resting there for a while. So now you got droplets that's getting on the outside and the inside. What happens is when you go pull that mask up again over your mouth and your nose, you've now just transferred all of those germs from your neck area directly to your mouth and your nose. And so I always bring this up because it's not a matter of just wearing a mask, but it's practicing hand hygiene before and afterwards. It's making sure you're removing it from ear to ear. And it's making sure that you're using it appropriately based off of the guidelines, because it's not just about wearing it, it's about wearing it correctly, or otherwise it can become a contaminated object that can then put you at risk for germ transmission. Next slide, please. So then with the infographics, just as I was mentioning, taking information to people in a way in which they can understand it. So helping people understand that when cloth masks, were an option. And by the way, I just want to say, whether it's an N95, a KN95, or a cloth mask, all masks still provide some form of protection. And so I don't want anyone to think that there isn't a such notion of protection, because there is. But this infographic was made of when cloth masks were available. And so many people don't think about how sensitive our faces are. And so this gave information about making sure that if you have sensitive skin, then maybe your detergent can't go on your mask, that has to go on your face, because it can cause you to break out. It's also reminding people that if they're out at a restaurant eating, it's not appropriate to sit the mask down on the table, but making sure that you have something to put your mask in so that way it's not openly exposed on the table. Also, too, not using your phone. So a lot of people don't realize it, but if I have my mask that's over my face and I have my phone up to my mask, all of the contaminants from my hand from touching my phone is now on my mask. And it's the same exact thing if I'm touching my phone. Anything that might have gotten on the outside of the mask that protected me is now on my hands that will come in contact with my phone. So it's making sure that we're paying attention to those factors. Next slide, please. Cell phones I describe to be our third hand. If someone was to Google it right now, you'll find out that cell phones are 10 times dirtier than the toilet seat. Yes, including E. coli and a lot of other nasty things. And these are the items that, again, we put next to our face, we may text on, and we transfer these germs, let's say, directly from our hands to our mask or directly to our face. And sometimes when our face breaks out, we think that we're breaking out because of something that we ate, but we're not realizing that the contaminants on our phone may have transferred to our skin. And it's important for us to make sure that we're cleaning our phone so that way we don't have outbreaks with our skin. Next slide, please. So I'm not going to talk about infographics for these, but these are more so just questions that you will want to ask when you're going somewhere. So we have to think about when we get a box of condiments, like let's say ketchup or, barbecue sauce. These items are inside of a brown paper box and they're 9 times out of 10 sitting somewhere. Maybe some of the sauce is busted, maybe not. Same thing with the little cups. Well, they place the cups directly next to your food, but somebody's hands had to touch those cups to put them directly next to your food. So, just as a suggestion, I always tell people to make sure that they're not letting the condiments be sat right next to their food that they're getting ready to consume. And we know that this happens a lot, even out in fast food restaurants, but this is just to make people aware of some of the things that are being touched. And I'm going through this fast because there is the preventionsaveslives.com website that has some of this information on here. And as you know, this webinar is being recorded, so you'll be able to go back and reference it and be able to read through. But just for the sake of time, I'm just giving an overview. And so even now, as we're going outside and we're beginning to socialize, as you can see in the image here, if people are all serving themselves and it's a self-serve event, everyone touches the silverware and oftentimes, or the serving spoons. I've seen serving spoons land directly down on the food, which means that the serving spoons that are laying directly down over the food, all of those hands that have touched those serving spoons are now laying inside of the actual container itself. The other piece of that is as you can see, this gentleman is hovering over the food. So if he's talking over the food, then the droplets that are directly coming from his mouth is falling over the food. So I always tell people, if you're going to do self-serve, that might be a time to appropriately have people wear masks. I will also tell people to not talk over the food while they're getting their food and to socialize afterwards. I also bring up stacked cups. You don't think about it, but if you have a stack of cups and sometimes the cups stick together, you 9 times out of 10 are going to use your hand to grab your cup off top, which means that your hand has now touched the rim of the cup that someone else has to now drink from. And so we just have to think about how are we restacking cups and how are we using the things that are around us. Next slide, please. In office spaces, right now, masks are a big deal in regards to should we wear them, should we not wear them? Are people being discriminated against for wearing them? When are appropriate times for you to wear them? If you're in a closed in break room and you know that there's no open ventilation, then to me, I would suggest wearing masks. Same thing with kitchens and same thing with bathrooms in closed in spaces. If you're going to be sitting down, let's say at break room tables, you would want to make sure that you clean off the surfaces because someone else could have been sitting there before you. They may have set their mask on the desk, and essentially you're walking into their germs. And so I bring these things up because we don't think about seasonal work changes, meaning, are we noticing that maybe Gina was out this week and someone was out 2 days later, and then someone was out 4 days later? We have to start then putting measures in place to say, is this some sort of outbreak that we now need to be cautious of? Next slide, please. Even for, I would say, our older adults or anyone that lives in, like, let's say a high rise, I would still be wearing a mask. If I was in an elevator, I would be cautious of my hands touching the elevator buttons because other people's hands are going to touch the elevator buttons. I would also pay attention in regards to how fast the elevator opens and closes. If it's one of those elevators that is going to hurry up and close you in it really quick, then you have to understand that it may not provide enough ventilation from outside air between getting on and off. And so that may again be the most appropriate time to wear a mask. And so even still now in elevators, in ride shares, I'm always wearing a mask for that very reason. And then too, finding out from the building manager how they're keeping track of cases and how they're keeping residents safe. And so these are all preventative measures that you will want to take into place. Next slide, please. Same thing with lifestyle habits. We know that smoking affects the lungs, COVID-19 affects the lungs. And so asking yourself, am I doing habits potentially that can be compromising my lungs further? Am I eating foods that are going to lower my immune system? Many people don't know this, but just 75 grams of sugar per day lowers your immune system for 5 hours. And so if you can imagine, that's a cup of coffee and a pastry. And so we have to think about the fact that if we're stressed out and we know that we're not working out, it might not be the time to consume sweets, because then that just sends our body over into a mode of where we're going to be sick. Understand, even if it's not COVID-19 that you're sick from, being sick then compromises you for COVID-19. COVID-19 then compromises you for being sick for something else. So that's how it works when you have a compromised immune system. But we do know that individuals that had boosted T cells, when it came to COVID-19 early on, these were individuals that had a high T cell count, which means that instead of them eating foods with additives in them and preservatives, they were more so sticking with lean foods as well as with vegetables, to build up their immune systems. Next slide, please. So I'm just going to end here. I'm not going to go too much into too much work, but I just want to show people this slide. I have this slide and then I have another one. And so as you can see, I have, I'm sorry, go back. So right here, this talks about May 2022, summer 2022, fall 2022, winter 2023. This slide looks just like the one that I put up May of 2020 when things were getting ready to open. So it says businesses reopen and restaurant outings, right? And I'm saying that now everyone's finally coming outside. We're 2 years later, but as you notice, guidelines are being dropped now. The last time we went through this, it was because everything was reopening after a shutdown. So everyone made it through the summer, everything was successful, quote unquote. But then the fall came and sporting events happened, which were in-house. People were going back to schools and universities. People were indwelling indoors more because the weather was cold. You then had it to where we started to have a peak, okay, in COVID. Same way that we would have a peak in flu season. We know that flu season goes from September up until April. We know the peak of that season is between December and February. We have to understand that at this point, because even still, you see potential for COVID vaccine is there. So we know that we're working off the same formula for March of 2020, and that new formulas will be needed because we're constantly using, I would say, new tricks on the old dog, which is somewhat effective, but not as effective as it should be. Or I would say we're using old tricks on a new dog per se. So it's the same situation of where we were 2 years ago. And so the question comes is, what should we be doing in order for us to stay safe collectively? Next slide. And so this is an example like of a Swiss cheese model, and it looks at the respiratory virus pandemic defense. And what it states is that there's not going to be one single layer of protection. Meaning, yes, hand hygiene may not save you from absolutely everything. Mask wearing may not save you from absolutely everything. Vaccines may not save you from everything, even when it comes down to surface cleaning. But the thing is if you do all of these things collectively, you decrease your risk that is associated with you getting COVID-19. Next slide, please. And so when you're thinking about safe practices, of course, there is vaccinations which exist, and which is the emphasis that we place on. But this looks at what should you be doing in addition to being vaccinated. And so it's still the social distancing when it's appropriate, the hand hygiene and masks. When you're talking about office safety, or I would say workplace safety, making sure that you're looking at community use surfaces. If everyone's using the same elevators, touching the same door handles, how can you address that? Ventilation, meaning are there air exchanges that are occurring? Does your employer have the most up-to-date HVAC system, which is heating, ventilation, air conditioning system? And even when you're thinking about home visits, client interactions, or interacting with others, you think about ventilation. Do you have that? So this may mean even when it's cold outside, keeping windows open. A visitation plan, meaning that who are they bringing? So not just having random people come over, but having a plan for if they come over, and essentially knowing their status if that's what makes you feel more comfortable, and making sure that you have sort of hand hygiene protocols. So there's certain protocols when individuals come to my home that they have to do just to make sure that they're ensuring their safety in mind. Next slide. And so this is another example of infographics. Again, a lot of individuals are not thought about, and this would be where you would again talk to your leaders in your community. So one of the individuals came and said, okay, well, I know that you have some information on what I should do to manage, my walker or my wheelchair while I'm out in public. What can I do to make sure that I'm staying safe? Because I have to go out and I have to commonly touch surfaces as well as touch my own personal belongings. And so being able to help them think through how that looks as well as being able to clean their assistive devices. And so you can keep going because I'm not going to discuss all of these. You can skip this one. Okay. This one I'm just going to talk about briefly. And it's just that old people saying of don't talk over children. This is literally don't talk over children. I would also say don't talk over older adults. So standing over someone and talking to them, you're putting droplets down on them. And so always make sure that you're talking to children or talking to adults eye to eye. Next slide. I don't know about y'all family, but my family love playing cards. And of course, we can't wash the cards. And so this is just making sure that you're taking time out to even wipe down the table. We're all hollering over the table. The droplets are going to be on the table. The cards are hitting the table. So making sure that you're taking time out to be able to clean the surfaces as well as even for hand hygiene. It may to some seem cumbersome, but it's always best safe than sorry because again, now we're walking around with a nice population that may be asymptomatic at this point. Again, just like how we were at the beginning of the pandemic, which is good if that means that not if people aren't dying. Okay, so it is good if people aren't dying, but it still means that we could be at risk for someone whose body may not necessarily be able to handle the disease. Move forward. Okay, move forward again. Move forward again. And so these are translated in Spanish. I'm briefly just going through the infographics just to say that they are in different languages. And so the Flint COVID Community Coalition does have access to this information as well. Move forward. And this is just a video of how they've been used. And so they've actually been put into these infographic card sets and passed out to the community. And so someone can put this in their purse. They can leave it inside of their cars just to have it. And it's really just to be mindful in thinking through it. And these were written by the community for the community, meaning that we actually went around and talked to people in the development of these materials, even asking people, well, why is it that you didn't follow up for your medications or go to your appointments? And the fact that they were saying, well, I didn't want to go there and get sick. And so helping people to navigate why it is they should still be going to get their medications, but ways in which they would do that safely, or to even see their doctors and do it safely. And so we can pass this too. The project is just stating how I've translated them. Even with my nursing students, we pass them out in the communities. And this actually provided them a way to be able to see the areas for which I grew up, which is Cleveland. So Cleveland is the largest poorest city. And with that, there's this perception that when you walk inside of the healthcare systems that exist here, which are some of the top ones in the world, that the patients that are seen is reflective of that. But this was important because our students need to see that not everyone that is in the hospital setting that's getting top-notch care has the same resources when they leave the hospital. And so this helped them to understand that just because these individuals live in these neighborhoods and may lack resources does not mean that we shouldn't be thinking about ways to give them patient-centered care. Move forward. And this is just other ways in which the infographics have been used. And so they may have been used at food drives, and they've put them on foam core boards in order for people to think about ways to stay safe, and have become a conversation piece for them to engage with the communities about what they're doing to stay safe. It's also available here on our YWCA website. So for example, they use them and provided their communities information so they can download the infographics and use them for themselves. And we've also used them for our urban housing development here, where we made sure that every resident and every employee received them as well. And that's what I have for now. So I was going to say my Facebook and Twitter has been updated to Hey Dr. Nina now. So those two tags are different, But if you do want to stay in touch, or if you have any questions about the materials, then the information is available for you to stay in touch with me. Otherwise, the Prevention Saves Lives website, which is www.preventionsaveslives.com, does provide information in regards to safety tips. Thank you.
All right, so we are, just as a reminder, we're doing a throwback for this webinar. So that was a session, that was a presentation that Dr. Shanina Knighton did for us in May. Still important information, particularly about those layers of protection, and I will never look at my phone the same way after listening to her. Next up, we have a medical moment. We could not do this webinar without Dr. Susan Woolford and her wonderful medical moments. So she's going to be talking to us about COVID testing.
Today, we're going to have just a little demonstration about testing. So when we think about tests, there are many ways to try to categorize them, but one way is by what they test for. The other is how they're testing, how we test. But if we think about what they test for, let's think about the apple. One type of test tests for things on the outside of the apple. As you might imagine, that's the rapid test. It can quickly get to what's on the outside, like you might be looking for a stem. It's easy to find, easy to test, easy to get an answer. And that's our rapid test. Well, that's our antigen test, let's say it that way, because we're talking about what they test for. And then if we think about another kind of test, rather than looking for what's on the outside, we would look for what's on the inside. And you need much more skill. And it takes a little bit harder to do because we have to get what's on the inside out. And so here we core the apple. And if we take what's on the inside out, then we can get to the seeds that are in the middle of the apple. And we can we can find the seed and test for that and see if that's present. And then we know that we have an apple. So with that in mind, we're going to talk a little bit more about this testing as it relates to COVID. And so with that, I am going to share my screen so that we can talk in more detail about the COVID testing. So as I mentioned, hopefully you guys, I hope you're seeing my screen there. We can test for different types of things. We can look at tests by how they test, and one day we'll talk about that in more detail, but we can look at what they test for, what are they looking for, and that's what we're focusing on today. So when we think about what they look for, there are three types of tests. First, the antigen test. Remember, that's like looking for something on the outside, like the stalk or the skin, something on the outside. Then there are the genetic tests. They look for something on the inside. That's like trying to get at that seed in the middle of the apple. And then you can test for antibodies. Remember, our body makes these antibodies after a while, and you can test the blood for that. That's like, I don't know, waiting for ants or fruit flies that come in to attack the apple. So those are the three different kinds of tests that we have. If we start with the antibody tests, these tests, they are looking, as we say, for those antibodies in the blood. You'll know you got most likely you had an antibody test if they had to draw blood to get it. And what we need to do is to remember that it takes time for those antibodies to form. So if you got COVID or exposed to COVID on one day, it really takes about 2 to 3 weeks for enough of those antibodies to be present in the blood so that when we test, then we would find it. So you really want to wait 2 to 3 weeks if you wanted to get an antibody test, if for some reason you needed that. As you can tell, that's not terribly helpful when it comes to finding out whether somebody is infected and spreading it, right? Because you have to wait too far down the line to get those answers. So that's the antibody test. Then if we look at the antigen test, that's the one looking on the outside. So this one usually is a swab, or it can be done by saliva. And again, if you get exposed and you get a test, you might want to wait. These tests, I don't say you want to wait, but these tests are more likely to be sensitive to tell us that you have it when we test on days like 3 through 5, because you need quite a lot of those proteins on the outside, that things on the surface. You need a fair amount of them to be able for the test to tell that they're there. So they're actually really good when you have enough of that virus present that you are spreading it. So if it's negative, if you got it too early and it's negative, that's not a problem. They're cheap, they're easy. You just get another one and it will turn positive when you have a lot of it and you're very likely to be spreading it. And then finally, we have that genetic test. Now, we've talked about these in great detail before. One type of genetic test is what we hear the term PCR a lot, the polymerase chain reaction. We've heard that PCR term. That is one way of getting this genetic material out. And in this way, the sample is sent to the lab, and then they get that genetic material in the middle, and they add a dye that helps to make and heat it and cool it, and helps to make a lot of the genetic material. So that is why even with a little seed, even with a tiny, tiny amount of that genetic material, we can find it, because the actual process of finding it multiplies it many times over. So you can find even a small amount. And then you add a dye, and the dye tells you, look, it's there, and we know we have COVID. So that is the gold standard. It can tell whether you have COVID or not, even with a tiny amount. But often we don't really need to find it when it's such a little bit there, because maybe we're not really spreading it at that point, because it will stay positive a long time after, because all it takes is a very little bit that we need. So those are the 3 tests that are available, and your doctor can help you decide which one. But if you think that you might have been exposed, the answer is to go and get that rapid antigen test. Cheap, easy, and it can tell you fairly early on whether or not you have been exposed to COVID, whether or not you have COVID.
All right. So again, just a reminder, we're doing a throwback for this webinar, this session. So that was a presentation that Dr. Woolford did for us in October. You might have heard this. So earlier in August, there were traces of polio found in the wastewater in New York City. And wouldn't you know, we talked about wastewater testing on the webinar in March of this year. So we wanted to show you again, bring back Dr. Jeff Ram, who gave us a wonderful presentation on wastewater testing. So we've got his presentation lined up, and he's going to fill us in.
Why are we doing such dirty, smelly work as working with wastewater? And we could get into later how a physiologist ended up becoming a microbiologist, but come on, slides, go. There we go. So here are the reasons why we're doing this work with wastewater. We're taking wastewater from the community and we're measuring things in it. We use this to identify the presence of SARS-CoV-2, that's the virus that causes COVID-19, in communities, and it provides an early warning for an increase in cases because people shed virus into their gastrointestinal tract and flush it down the toilet often before they have any symptoms. It can also be used to let communities know of declines in cases or to confirm that and whether there's virus present. And you've heard from a number of people before me how it seems like we're going into a low time as far as the virus goes, but don't let your guard down. Spoiler alert, I'm going to show you some new data that causes me to have more caution than I did last week. And we use it to alert communities, hospitals, and public health agencies so they can get ready for surges. It can also be used for scientific studies to measure the effectiveness of the various mitigations. Each slice of that Swiss cheese, how effective are each of those? And people have done studies of those. And one of the measures is what's happening in the entire community as measured by the wastewater prevalence. And also, as you heard from Dr. Deborah, people may be doing more home tests so it doesn't get reported publicly. And in under-resourced communities, there may be people that don't test at all. If they think, oh, it's nothing getting COVID, I know what I have and I'm going to recover because I've been boosted. We may not see that as early as we'll see it with wastewater. This is my research group. They're not all working on wastewater, but several of them are. Sophia Yusuf, whom you'll hear from a little later. I'm sitting in the center. Azadeh Bahmani, Adrian Vasquez, and Nick West over here, and Mohammed Khan are all working on the wastewater project. And in fact, Orib Khan, who's standing there right behind me, he's working on it too, because he orders all the many supplies that we need. He's the business person for the laboratory. The other people in the picture are working on other projects, and Azadeh designed this beautiful logo that shows all the things that we work on. And the laboratory is doing a lot of different things. This is just a brief introduction to the sorts of things. First and foremost, for now, detection of, traditionally, up till now, up to the pandemic, we were doing some work detecting human sources of fecal contamination in watersheds and at beaches. So we knew something about sewage. So when the pandemic started, I consider this the Manhattan Project of our time. Any scientist who had a skill or method that could be used for helping to solve the problem of this pandemic, really, there was a moral obligation to do that. So we used our knowledge of sewage and how to measure things molecularly to do wastewater-based epidemiology. We also use those technologies for detection of vector-borne disease organisms, such as for Lyme disease. And there are other projects. The top three projects actually grew out of the bottom two projects, where we study basically out of curiosity. These are organisms hardly anybody has ever worked on at all. We study the diet and diversity of water mites. They don't cause any human disease, but they do eat mosquitoes, mosquito larvae. And we also work on extracellular calcium receptor. It's a kidney-related project, may have relevance to people who have renal disease. Here's our mission statement, but I know I only have about 20 minutes, so I'm going to skip through that. I've already given you an idea of what we work on, but here's a picture of where we do part of our work, manhole covers all around the city of Detroit. And there's a cartoon of what we're working on. Who's involved in this project? I'm the director of the molecular microbiology laboratory, but I couldn't do this project without somebody that knew a lot about sewers, and that's Bill Schuster, who's the chair of civil and environmental engineering. And so we've been working on this 50-50, basically. It's a collaboration between engineers and microbiologists, basically. So, and we interact with a lot of people. Before this project, I didn't work on viruses. I worked on bacteria and on mammals and invertebrates. So for the knowledge of viruses, I consult people in the microbiology department. Already mentioned, we go to engineering for knowledge of the sewage systems, and we collaborate very closely with the Detroit Health Department. They provide health information for us. We provide community data on where we're seeing SARS-CoV-2. The project is funded by the Michigan Department of Health and Human Services. It was actually initiated by EGLE, the Michigan Department of Environment, Great Lakes, and Energy, who was doing a lot of molecular work as we were on beaches, and they saw immediately and got together with MDHHS and said, we can do this in sewage because there's evidence that it gives early warning. And there's a website for MDHHS. I know you're not going to write this whole website down. Just look for Michigan wastewater testing and you can find it. And how do we do this? How do we know what the level of COVID-19 is or will be in the community? There's 3 major steps. We go out and we collect sewage through manhole covers. There are other groups around the state that go directly to the wastewater treatment plant. But you know, in Detroit, the wastewater treatment plant gets sewage. Well, you know this better than anybody else. I think you're still having, again, your sewage treated, it was the drinking water, excuse me. But your sewage probably goes through Great Lakes Water Authority. And so they get sewage from about 3 million people. They divide it into thirds. So they're getting about 1 million people from each one of those collectors. We collect from sewer sheds, we call them, that have anywhere from 1,000 to about 10,000 people in them. So there's collecting, processing, I'll show you a few things on that, and then sharing the data. So I don't actually go out and pull the manhole covers. I worked with Limnotech on one of our bacterial beach contamination problems before, and they wanted us to look at a sewer in Ann Arbor, as a matter of fact, that might have been contaminating the Huron River. So I called them up when the pandemic started. And I said, "What do you think about collecting water so we can measure SARS-CoV-2?" And they were enthusiastic about it. And then we found out that the state wanted to do it too. We go for sewer sheds. The little map here, that's of Detroit. And I've covered over the names of some of the sites there because some of them are associated with nursing homes or correctional facilities. And there's ethical and legal issues associated with advertising all the sites. But zip code wide sites, it can't be identified to any single person or institution. This is 48235. So the ones that you can see the levels, and also Wayne State. Wayne State makes everything public. They're transparent. And the types of sampling, we take grab samples. That means we drop a bucket in and we pull out the water that's going past right at that time. So we might miss something, or we might get it right when it's passing through. And we also do something that's called a Moore swab. It's a fancy scientific name for what are actually tampons, well-known devices for absorbing fluids, right? We sample for 4 dormitory sites at Wayne State and 16 other sites across the city of Detroit. Yvonne, how much more time do I have?
You've got about 5 minutes, Doctor.
Okay, thank you. Well, we'll get to the data soon because that's really important. And the samples are delivered to our lab. Upon delivery, it's processed by the people I already introduced you to, and that has 2 steps. We extract RNA. RNA is the genetic material of this virus. Not all viruses are RNA, some are DNA, but this one is RNA. And then we measure the amount with a special type of PCR called ddPCR. This is just a cartoon of the virus, just showing genetic material as RNA. And we use what's, for want of a better word, a robot to help us do the purification of the RNA. We have to do a little hand holding with it, put it into a tube, add a few chemicals, put those tubes on something to heat it up that helps the extraction. Then we put it in this machine that's over here on the right, and 75 minutes later, we have pure RNA from wastewater. And then we do a special type of PCR called ddPCR. It's explained in detail over on the right side here. But the important point about ddPCR, it is a more sensitive method than ordinary PCR, which is used for clinical samples. So we can detect the small amounts of virus, or the relatively low concentration concentration of the virus markers in wastewater. I can tell you wastewater has lots of RNA. It's got RNA from humans, it's got RNA from bacteria and the virus markers. We need a very sensitive technique to tell it. This ddPCR machine, once we put the samples in, it's hooked up to a computer. Actually, it's a separate machine, a droplet reader. The DD stands for digital droplets. It's hooked up to a computer. It does some complicated statistical analyses of the droplets. And that's where our project communicator comes in, Sophia Yusuf. Sophia, do you want to give us what you have to say about how you communicate? I'd like to introduce you to Sophia. She's an undergraduate. She's a MedDirect public health major, this is a great project for her. I hope it'll help her get into med school. Go ahead, Sophia.
Thank you, Dr. Ram. So hello, my name is Sophia Hania Yusuf. I go by Sophia, and I work as the project communicator. So I essentially help to make the data look pretty. So what happens is that once we, the digital droplet reader processes all the data, and then it gets processed through Excel into these macros, and those macros get delivered to me. So we use that data to ultimately provide reports to the Detroit Health Department and then the campus health committee here at Wayne State, and a graph of public data. So we use that data to predict and track trends in COVID and just be able to see whether we might have an outbreak or not. So as you can see here is a graph on the logarithmic scale. The changes in color indicate that I'm sorry. So as you can see here, part of the graph is blue. So that indicates that a change in the different technology that we use for RNA extraction. Previously, we had been using different one. Now we use ChemMagic. So as you can see here, the peak near in the beginning of November, that just shows that the Delta variant was present on the Wayne in Detroit, and especially the Wayne State campus. So in response to these high fluctuations that we saw, we actually had a COVID-19 testing event at one of the dormitories. I actually took part of it. It was fun. $20 came out of it. And then afterwards, as you can see here, around December 19th, which was towards the end of finals week here at Wayne State, we again saw really high signals in the city overall, but also especially at Wayne State. It was so alarming that we told the campus health committee. They took that and the number of cases, positive cases on campus into consideration, and ultimately decided to close campus for about a month and pushing most operations online. And now, as you can see, since that closure, we've been declining, but however, as of this week, we do have a peak. A couple of other sites, particularly in East Detroit, we've been getting a couple signals, and it's pretty concerning, just given everything that's been going on in the world. Obviously in Wayne State, we've removed our mask mandate. COVID restrictions nationwide have been loosening up. However, in the news, there is a new variant called BA.2. It is particularly taking hold of China and the United Kingdom. So the fact that it's rapidly spreading over there is we usually use those countries as a way to predict what might happen in this country. So the fact that we have such high signals all of a sudden, especially during our Wayne State spring break, that is pretty concerning. If Dr. Ram would talk about these slides next.
Yeah, so I just want to finish up by saying, to show you two individual sites. And I just want to say that the high sites were on the west side and the south central.
Oh, I'm sorry.
Yeah, but this is, things like that, we have to be careful at where we might identify something. However, the northeast location site that Sophia was referring to is actually the site that's here, site SG. You can see how an individual site, this is a zip code wide site, rose up. This was during the Omicron surge and came down, but the peak that you saw this week wasn't from this particular site. And just to show you how it relates to the signal we're getting from hospitals, you can see on the bottom one, this is from the sewage that's coming from the Detroit Medical Center. And you can see the peak at a place like SG, a community site, peaked at the end of December, and the DMC didn't peak until near the end of January. And the earlier peak that followed a rise that happened in September. So these data did produce public health responses. Sophia mentioned the $20 incentive for students to get tested, the mostly online operations at Wayne State in January, and a couple of sites that we notified the health department in Detroit about, and they said they would give the information to their investigations and testing team to see what's going on in those neighborhoods. It's not necessarily from the nursing home because there's other sewage that comes into these sites, but that's certainly a high value site that they could look at. And this is just a repeat of my first slide. We asked these questions at the beginning, and I think we've found data that supports. We get early warning. We can also let communities know of declines, and this week that it's popped back up. I have to say, last week I went into some place and didn't put a mask on, and then I heard that President Obama tested positive, and I put the mask on right away. And then I saw our data, and I said, yeah, it's too soon to take off the mask. And Dr. Deborah mentioned about under-resourced communities. That's it. Thank you for your attention.
All right, so again, we're doing a throwback this week. That was a great presentation by Dr. Jeff Ram talking to us about wastewater testing, but we also want to make sure that we keep you informed of what's happening in our community. This is a holiday weekend for some who might be traveling or spending time with family, so we're going to ask Al Harris to tell us what the numbers look like.
In so many words, it's just basically a slow tick. It's not getting better, it's not getting worse, but it is maintaining. And as folks go out and travel and then come back, people go back to school, and we're going to start to see it increase. But it really has been maintaining just across the board, but it just means that it's staying present as well. So it's not good, it's not bad or terrible, I guess. Yeah, that's the long and short of it.
Good reminders. Thanks so much, Al. All of those layers of protection are so important for us to maintain. We know that on your mind is probably the boosters, that there's been a lot of talk this week about boosters. And I want you to know that next week we've invited Dr. Paul Kilgore to come back. He's been on the webinar before, and he's going to be filling us in on the boosters, what we need to know, and also we'll find out when we will be able to access it. We also want to remind you of a couple things. So if you have not already signed up for the Healthy Flint Research Coordinating Center's Research Symposium, we want to encourage you to do that. You can go to the hfrcc.org website and find out more. In fact, check out that website. It's been updated. It looks amazing. So you can see the resources available there. But again, sign up for the symposium. You'll find lots of good information that we're going to be sharing there as well. All right, our social workers and community health workers are always near and dear to us, and we want to make sure that you're getting those CEUs. So make sure that you click the link that's gonna pop up once you exit the webinar, and you can fill out the Qualtrics form and make sure that you get those credits. You can reach out to Blair Warren. We have a new email address here, so it's Blair Warren is going to be handling those inquiries in case you have a question. Her email is ware, so WARRE 152@msu.edu. And then make sure that you like us on Facebook. Check out our YouTube channel if you want to look at more presentations from previous webinars. You can also email us at info@hfrcc.org. And as always, you can give us a call. We have a new number here, so make sure you jot that down. It's 810-777-5932. Again, that's 810-777-5932. And be sure to join us next week for session 130. We look forward to having you back on the Flint Community Webinar on coronavirus, and we'll see you next week.